Welcome back to Rohrich Knows podcast. Understanding aging. There's been a recent study from Stanford that talked about the two bursts of aging that are dramatic at age 44 and 60. So let's explore about that and how do we prepare for that and how plastic surgery can help. And so this is really not surprising, but it's a study that shows that you have two significant bursts of aging at 44 and 60, and I've passed both of those, so I think we've survived. So what really affects the physical appearance both internally and externally? So let's look at genetic aging versus environmentally. And genetic aging is probably 90% of how we age. And this is a more photo of somebody who's in their 20s all the way to their 70s. And really you see a lot of things happening. You see fat atrophy, skin loss, bony atrophy, and you can see when you go from 20 to 40 to 50 to 70, you have incredible elongation of the face, jowling, loss of facial fat, and bony atrophy. So, but what really happens is the most dramatic things that happen are facial fat compartments, because these are specific compartments of the face that actually age rapidly, and the central facial fat compartments age earlier, as well as the lateral cheek ones, and these are the ones that make you look older. So that's why you got to be careful about how much fat you remove, especially in buccal fat, but also the key is how you replace it, because facial fat atrophy should be replaced like for like, and that's very important. So what happens at age 44? You get changes in skin elasticity and collagen depletion begins, and so you begin seeing early signs of aging. So you have hormonal shifts. Lifestyle, of course, plays a significant role. But what are the preventive strategies that you can do? Obviously, hydration, diet, exercise, sleep, all these things are important, And then I think the key is, the cardinal three skincare, the antioxidants, vitamin C, the use of retinoids, a retin A, to actually help turn over your skin and actually dermal thickening, and of course sunscreen. Those are the triad of skincare that you must follow, and all the other things. Avoid sun tanning. And tanning beds. Don't smoke. Meditate. Try and do a low-calorie diet if possible. Exercise. Keep moving. That's the key in life. Keep moving. Keep going. And these are all the non-surgical things like Botox and fillers, the skincare that we mentioned, and the exercise. These are all things that can be done in moderation. That's why you need to find a skilled skincare and plastic surgeon that can understand the science of aging and can treat you from your 30s and 40s to your 60s when you need other things. But in your 40s and 30s and 40s, you really need non-surgical things in general. It's good skincare, like in this patient. You're going to do great skincare. You're going to do chemical peels to rejuvenate the skin, because the skin is the largest organ in the body. And then you can do liquid filling of the central face and doing Botox to help with the commissures and really rejuvenate the face, because in this patient, she doesn't have jowling. So you can rejuvenate it with volumizing the face and the cheeks. And these are all things that are very helpful. And then, of course, when you get in your 60s, you have true volume loss and you have sagging skin. And I think those are things that you can actually do things that are much more profound, and that's when surgery is indicated. And that's when you have bony loss, fat loss, and of course, that triangle of youth becomes the square of aging. And I think that's really the most important thing, is you want to return to that triangle of youth, and with the bony changes and the fat loss. So this is where you have to do surgical options. Facial rejuvenation, the combination of face, eyelid, fat augmentation, lip lift, lasers, even hair transplants. These are all things that are done in the 60s and that really help to give you not so subtle but optimized treatments, because the worst thing you can do is to continue doing fillers and neuromodulators in your 60s, because then you'll look weird. The key is to look normal, not weird. We're in the face protection, not witness protection program. That's the key thing. So change in the anatomy, understanding how facial aging is really important, because how you age really depends a lot on your genetics, but also on facial fat compartments, as you can see here in this patient that had facial aging, and she had a facial rejuvenation with eyelid surgery, a deep layer facelift. really giving you a shaping and contouring that looks youthful and natural. And here's a patient that also underwent facial rejuvenation with central facial aging, and she had, aging. So you can see in this her showing her 3 years post-op after facial rejuvenation. Another patient, facelift, central facial fat augmentation. All these things are very, very powerful tools that you can use when you have volume loss, skin laxity, and the things that really allow you to give you a harmonious face with using long-term facelift strategies, and these are surgical strategies. So I think the most important thing is maintaining your youthfulness throughout the cycle of life, whether it's at age 44 and 60. I think the most important thing is to do it gradually, do it gracefully, and do it incrementally, and following the advice of a true board-certified plastic surgeon that understands the science and power of facial aging and how to correct it surgically and to correct it so that it's harmonious with the rest of your face. Don't do crazy stuff. Give me your thoughts, give me your comments, and until next time, stay safe, stay educated.